Okay. This is Amelia Hill, and I am doing my Foley catheter check off. My D number is D4104827. The first thing I'm going to do is I'm going to verify my order. And here is my order from Dr. Feelgood for patient Pat Chamberlain, 1/2/1962. The second order is to place indwelling catheter due to bladder retention, post-op bladder surgery. Remove after 24 hours. That might be backwards, but that's what that order says. So I verified my order, and now I'm going to go into the room and speak to the patient. Hey, Mr. Chamberlain, my name is Amelia. I'm your student nurse today. The doctor has requested a indwelling catheter due to some bladder retention that you've been having post your bladder surgery. Can you give me your name and your date of birth? I have hand sanitizer here. And the patient has given me his name and his date of birth. And first, I'm going to give you the rationale for this. The reason for this Foley catheter, indwelling Foley catheter, is because you are retaining urine and you're not emptying your bladder as well. So it will be going into your bladder. It's a sterile procedure, and then after 24 hours, we're going to remove the catheter to decrease the chances of you becoming infected from having the Foley catheter. Do you have any questions? And he says no. And then I've given the rationale. The reason we're putting it in, the reason we're taking it out, giving the patient a chance to answer any questions, and now I will ask permission if he's okay with me putting it in, and he has said yes. So can you tell me if you're allergic to iodine, shellfish, chlorhexidine, or latex? The patient has said no. So I will raise the patient's bed to hip height, and my patient would probably be sitting up while I was talking to him. So I would lower his head down to a supine position. I'm going to do hand hygiene and lower the side rail. First, I'm going to assess for bladder detention, which the patient does have some. And then I'm going to fold back the covers, kind of quiet, exposing his perineal area. And I'm going to look for redness, rashes, open sores, or any skin breakdown, which I don't see any. Okay, so you are going to feel me touch you. My order over here. But the first thing I'm going to do is I've performed my hand hygiene. I've got my catheter kit here. I'm going to remove my catheter kit. Okay. And I'm going to use this as my trash can. This is my Foley catheter kit. And before I open that up, I'm going to, like I said, lower the patient. I will have the patient bend their knees and kind of turn their ankles inward. I will have her turn her ankles inward. That will give me a better view of the perineal area. Okay. So I'm going to open this kit away from me first Then I'm going to open both sides, and then I'm going to open the flap towards me. And then I would put on my sterile gloves, which my left hand will be my non-dominant, and my right hand will be my dominant hand. This first one I will actually take and use it to put underneath the client's perineal area and ask them to lift their hips up. And because I touched them, I'm going to do hand hygiene again. I'm just going to put that right there. I did touch them. I'm going to slide this up just a little bit and actually slide it over. I'm reaching underneath my packaging so not to touch the inside of my sterile field. And I'm going to put on my sterile gloves. And I'm only touching, my gloves are folded funny, the inside of my cuff here. I'm sorry, my cuff is folded upward. I'm having to flip it down so I can get, okay, so. Okay, give me 1 second. My gloves are folded funny, and it's making it harder for me to open these up. Okay, so I have my sterile gloves. I'll open these up. I'm going to touch just the cuff. And then I'm going to reach in the inside of this cuff and put these on. And now that I have these both on, I can adjust them as I need to. Okay. And I can take this and put it in my trash. And then I would take my sterile kit and slide it in between my patient's legs. I don't need, oh, that was all my cotton balls. I do need that. I don't need this specimen container. And I have cotton balls, I have my iodine, put that there. I'm going to take, that's my lubricant, that's to the side, and this side, that's paper, just going to toss that. Okay, so I take my iodine and put it all over my cotton balls here. Toss that. Okay, Mr. Chamberlain, you doing okay? So I'm ready to put your Foley catheter in. I am going to attach my syringe here. I have everything set up, so I'm going to take my non-dominant hand and I'm going to spread the labia minor, and I'm going to locate the meatus. And I'm not going to take my eye off of it. I'm going to take a cotton ball that's been drenched in the iodine, and I am going to clean from the clitoris to the anus with one cotton ball 3 times. So I'm going to go clean, toss, clean, toss, clean, and toss. So I will really be doing left side, right side, and then down the middle. Okay, Mr. Chamberlain, what I'm going to need you to do is take a deep breath in, and then as you blow out, kind of bear down when I tell you to. So take a deep breath in and bear down. And he is bearing down, and I'm pushing, pushing, pushing. I've got my flash of urine. Once I have my flash of urine, I'm going to push the tubing another 1 to 2 inches. I'm going to let go with my dominant hand and grab the tubing. With my dominant hand, I'm going to inflate the balloon by pushing in the 10 cc's of normal saline. And now that the catheter is in, I'm going to pull slightly, getting just a little tug to make sure that it's secure. And now I'm done with being sterile because we're done putting this in. I would secure this to the bed frame, and I would secure the catheter to the patient's leg with either a leg strap or whatever device that the facility has. You doing okay, Mr. Chamberlain? Okay. And he has said yes. So now I'll just clean up my stuff here. I would throw all this away, obviously. I'll throw all this away. And I'm going to assess the color of the urine so I can document the findings. And the patient's having no trauma, no bleeding. Don't seem to be having like a localized reaction. I would clean the peritoneal area from all the iodine, and I would cover the patient back up. I will raise his head of the bed up. I'm going to lower his bed. I'm going to lock his bed. No, I'm sorry. Let me back up. After I clean him up, I'm going to take these gloves off. I'm going to perform hand hygiene. And at this time, I'm going to get these on. Okay, Mr. Chamberlain. So we're going to clean you off and get you all situated, get your bed bag, get you covered up. I'm going to assess him for pain again. He says he's not having any pain. I'm going to make sure his side rail's up. His bed is in the lowest position and it's locked. I'm going to raise his head up and make sure his call light is in reach. And I would just tell him that, you know, this Foley's in now. It's draining to a leg bag on the side of your bed. Make sure not to raise the bag higher than the level of your bladder. If you start to feel any discomfort or pain, let me know. I'm going to report my findings to the doctor. We're going to be emptying this every shift. And I'll ask the patient, does he have any questions? And he says no. So that would be putting in the indwelling catheter. Now, removing the indwelling catheter, I have my order already that I could remove after 24 hours. So it's been 24 hours. So I would verify the patient. I would raise the bed, provide privacy, let him know what I'm about to do. I have a pair of gloves here. I will let him know that the doctor wants us to remove the Foley catheter. So I'm going to put on the gloves. And I would have taken this pad out, but since I'm about to pull this out, I don't want to get water all over my table. So I did leave this absorbent pad here just so I could do the removal and everything all at one time. I'm going to remove my security device that's securing the strap in place. I'm going to attach the syringe, and I'm going to tell the patient to take a deep breath in. I'm sorry, hold on. Oh, shoot. I'm going to pull out the saline, holding on to the tubing. And then once I get all the water out, I'm going to tell the patient to take a deep breath in and exhale. And as the patient is exhaling, I would pull out the catheter, holding it to catch any dribble. But I still got some there. I will assess the patient and make sure he's okay. And I'm going to drain all the urine into the bag so that can be measured. And I'm looking for the color, any mucus, any infection, signs and symptoms of infection, which the patient looks clean, the urine is clear, patient is doing well. I will cover the patient back up. I'll take this out finally. I'm going to have the bed in the lowest position. It's going to be locked, side rolls up as needed, call light within reach. I would take my gloves off and measure my output, and I would discard the whole drainage system in the trash can. And I would perform hand hygiene, and I will let the patient know, your urine's still clear. Now we're going to just watch you and see if you can empty out your bladder on your own. If we don't have any urine output, maybe in 8 hours, we'll have to contact the doctor and see if he wants to put the indwelling catheter back in. But the patient voiced that he's having no pain, no discomfort, so that would complete this Foley catheter indwelling and removal checkoff.